Greetings everyone. Today I'm gonna present you about the artificial vascular grafts, and these are contents for today. Begin with the introduction to artificial vascular graft. The artificial vascular grafts are the synthetic or natural materials that used to replace or bypass damage or the diseased blood vessels, particularly in the case of cardiovascular disease. And the development of these grafts has been driven by the limited availability to healthy autologous vessels and the incidence of the post-operative complications. To classify into two categories based on the vessel diameters, which are the middle and large caliber grafts and the small caliber grafts. Begin with the biocompatibility, which is a critical factors in the success of artificial vascular graft that choose possess suitable mechanical properties and anti-thrombogenic surface, and also have the ability to support endothelial cell attachments. However, the synthetic vascular graft often exhibits poor biocompatibility characterized by the thrombogenicity. So the surface modification can be modified with the bioactive molecules like RGD peptides to enhance the cell adhesions and proliferations. For heparin coating, the heparin can be immobilized on the graft surface to improve anti-thrombogenic properties. Another one is decellularized scaffolds, which natural vessel that can provide a biocompatible scaffold for vascular tissue engineering. And the last one is vascular endothelial growth factors coating, which can promote endothelial cell proliferations and migrations. So let's talk about the type of materials that used in artificial vascular graft. Begin with the biological materials. First one, biological material like autologous vein, such as the autologous vein are commonly used in artificial vascular graft that they can offer good biocompatibility and also reduce the risk of the infections. Next one is decellularized tissue, such as xenogenic and allogenic vessels that use as a graft materials that they have reduced immunogenicity and the potential for remodeling in the host. The last one is biosynthetic material that include those derived from the extracellular matrix components, offer the advantage of the control fabrication and potential for tailor properties. Next one is biocompatible materials such as the dragon and the collagen that commonly used due to their biocompatibility and ability to support tissue regenerations. And about the biodegradable material like the polyglycolic acid and polylactic acids that offer temporary support to the blood vessel, gradually breaking down as the natural tissue heals and takes over. The last one is natural materials that like silk that can provide alternative approach, leveraging the body's natural compatibility with this material for improved outcomes. Another one is the synthetic materials that example for the expand polyfluoroethylene that excellent mechanical properties and has been widely used in vascular graft, and the PET also known for their high tensile strength and resistant to chemical degradations. Another one is polyurethane that provide flexibility and often utilized in the application for the versatile fuel and resistant to kicking essential or requiring compliance with natural vessel movement. The last one is the biomimic materials, include the hybrid constructors and the nanocomposites material and also bioengineering scaffold. So let's talk about the surgical techniques for the implanting artificial vascular graft. The techniques include the minimally invasive procedure that can reduce the patient trauma and robotic assist surgery that to enhance the precision and minimize procedural complications in the implantation also. And the image guide navigation also precise the utilized for the precise navigation during the implantation procedures. And the last one is the tissue engineering approach that can improve the host tissue integration and also reduce the risk of the graft failure. So talks about the clinical outcomes and the long-term monitoring. Begin with the hemodynamic monitoring that continues monitor the hemodynamic parameter to assess the graft patency, the blood flow, and the overall vascular stability post-surgery. Next one is the evaluating hemodynamics performance, that the assessment of the hemodynamic parameters and the blood flow patterns that can provide the insight into the graft functionality and the identify potential complications. For long-term surveillance for graft patency, the regular surveillance through non-invasive imaging and the Doppler studies ensure early detection of the graft stenosis or occlusion that can facilitating the timely interventions. The last one is managing graft-related complications, which is the effective management of the implications such as the infections, anastomotic pseudoaneurysms, and the graft dilatations, which is crucial for the ensuring of optimal long-term outcomes. The topic of the challenge and the complications association with the artificial vascular graft begin with the biocompatibilities and the material selections, where the choice of the polymer for artificial vascular graft is crucial for ensuring biocompatibility and the long-term success. Factors such as the thrombogenicity and the compliance and degradation rate must be carefully considered. Another one is the surface modification techniques that we previously talked about, that is include the coating and the functionalization that are utilized to improve biocompatibility of the artificial vascular graft. And these techniques aim to minimize thrombosis and to promote endothelializations. Another one is the inflammatory response to a graft material, that the immune response to the implant vascular graft, which have a significant concern with a potential implication for long-term patency. To understanding and mitigating inflammatory reactions is crucial for graft performance. The last one is the bioabsorbable and versus the permanent material, that the choice between bioabsorbable and permanent material for vascular graft impact their interactions with the host tissue, influencing factors such as the healing, remodeling, and the long-term outcomes. For the hemodynamic performance and the thrombogenicity, begin with flow dynamics in vascular graft. The hemodynamic behavior with an artificial vascular graft is significantly influence the thrombosis risk, neo-intimal hyperplasia, and the overall graft functionalities. To optimizing the flow pattern is the vital for graft success. Next one is the thrombus formation and anti-thrombogenic strategies, which we aim to prevent the thrombus formation with the required innovative anti-thrombogenic strategy. These include the surface modification, the dark eluting coatings, and the novel anticoagulant approach. Another one is the shear stress and endothelial cell functions, with maintain appropriate shear stress level, which is crucial for supporting endothelial cell function within the vascular graft. And understanding and promoting endothelial health is essential for the long-term patency. The last one is hemocompatibility testing and standard. To evaluate the hemocompatibility of the artificial vascular graft involve the rigorous testing to ensure compliance with industry standards. For the infections control and tissue integrations, begin with antimicrobial coatings and strategy, which we aim to develop effective the antimicrobial coating to prevent infection-related complications, which can have a severe implication for patient outcome. Another one is the host response and tissue integrations, with we understand the host immune response and promoting favorable tissue integrations that are essential for reducing the risk of the infections and enhancing the long-term performance of the vascular graft. For the biofilm formations and management, we controlling the biofilm formations on the surface of artificial vascular graft have a critical aspect of infection management strategy to prevent and manage biofilm play a vital role in graft durability. And the last one is tissue engineering approach that we aim to enhance tissue integration that can lead to reduce the infection risk and promote a more natural physiological response with the implant graft. Last but not least, let's talk about the benefits and the risks of the artificial vascular graft, which can improve the blood flow restoration, reduce the complications, and the long-term durability. And the aspects of the enhanced blood circulatory, which can improve the blood flow dynamics, reduce the risk of ischemia, and potential for improved patients' outcome, and also potential for reduce the amputation rates. And last but not least, there are still risk of infection and the rejections. For the infection management challenge, artificial vascular graft pose challenge in managing infection risk, necessitating vigilant monitoring and care. For potential of the graft rejection, there is a list of body rejections to the implantation, so they also require a careful post-operative monitoring and the management that previously mentioned before. And for the immune response considerations, the potential for immune response to the graft material require close attention to prevent rejection and delayed complications. The last one is the risk of long-term complications, where which the long-term list includes the potential for chronic infections and the rejection issue that necessitating the ongoing medical management that we already mentioned previously. So, thank you for your attentions.